Welcome to today's Clean Air webinar, where we will explore the linkages between climate change and air quality and the impacts on the health of Canadians. With National Truth and Reconciliation Day coming up on Friday, September 30th, we think about the learning and unlearning we need to do both individually and within our organizations when it comes to the Truth and Reconciliation Commission's calls to action. Just as we all share in breathing the air around us, we all have a role to play in fulfilling the calls to action. I'd like to acknowledge that we are on Treaty 6 territory, a traditional meeting grounds, gathering place, and traveling route to the Cree, Saulteaux, Blackfoot, Métis, Dene, and Nakota Sioux. We acknowledge all the many First Nations, Métis, and Inuit whose footsteps have marked these lands for centuries. I invite you to take a moment to reflect on the land on which you join us from today. And I know that our guest speakers today from Health Canada are from not Treaty 6, a little bit further to the east. So welcome today. My name is Julie Cusick, and I'm the Community Engagement Coordinator for West Central Airshed Society and Alberta Capital Airshed. Today's webinar takes the conversation another step further from our previous Clean Air webinar, and it takes that climate change and air quality relationship and adds in the element of health and the impact of health on Canadians. So join me today in welcoming our speakers. We have Marika Egyed and Phil Blagden, who are co-authors of the Air Quality chapter in a recent Health Canada report called The Health of Canadians in a Changing Climate. And we will link to that report in the chat throughout the webinar, as well as post it to our post-webinar email that goes out to everyone who registered. Also today, we'll have Gary Redmond, Executive Director of West Central Airshed and Alberta Capital Airshed, join us, and he will just provide that brief airshed context to the conversation. Now, housekeeping and how this hour will go. So the panelists will give their presentation, and once the presentations are done by all of our speakers, we will open the floor to question and answers. As the panelists present, you might have comments or questions. That's okay. We want to see those come as you think of them. For comments, you can use the chat function. And for the Q&A questions that you would like asked during that period, please use the Q&A box. Finally, there are no bad questions. Attendees today range from regular community members to academics to staff working in municipal and industry sectors, as well as those working in public health. So I would like to advise you as well that this webinar is being recorded and will be shared to the Alberta Capital Airshed and West Central Airshed websites, as well as our social media channels. Finally, please save the date for our next webinar taking place on October 27th at noon, and I'll have more information about that later. With that, let's get started. So Gary Redmond is not on the camera today. He's away and just has some connectivity that we want to make sure we can hear his voice, but he is there and you will hear his voice very soon. And he's, our Executive Director of West Central Airshed and Alberta Capital Airshed, and providing that great leadership on air quality management within Alberta. So over to you, Gary.
Thanks, Julie. Can you hear me okay?
We sure can.
Excellent. Okay. Well, hello, everyone. My apologies for not appearing on camera. I'm actually been called away from Alberta, and I'm just in not a great spot for connectivity. I think these webinars are a great way to connect together with air quality stakeholders to learn and share about important topics. It's interesting because they were born out of the pandemic as a necessity, but I do hope they'll continue on as a legacy as part of our community engagement work. It's interesting to me that the world of air quality is often held apart from discussions on climate change, at least in Alberta, despite the large overlap. It's really in the past couple of years, as we witness the impacts of a changing climate on local air quality, that our own airsheds have elevated the causes and impacts of climate change within our own strategic plans. We're not starting completely from scratch. For years, our school-based air quality programs have piggybacked on school curriculum that around climate change. But I do see us connecting the dots more so than ever before going forward. So this webinar is timely. The work that Health Canada has done provides an excellent basis for this heightened strategic focus and will certainly help ACA and WestCast achieve their goals. For anyone on the webinar today not familiar with Alberta's airshed model, the Alberta Capital Airshed and West Central Airshed Society are 2 of 10 airshed organizations in Alberta. Our primary role is to monitor the ambient air quality to determine the level of pollutants in the air we're all breathing. We do this by using a range of monitoring technologies and strategies. Both the ACA and WestCast have a network of monitoring stations that house precise analyzers for air pollutants. These stations are managed 24/7 by a team of airshed technicians and data specialists who ensure the validity of data by making sure equipment is accurately functioning, calibrated, and reporting real time to a dedicated server. Very importantly, this data is also available to the public through our websites. To supplement the data from these networks and to ensure monitoring information is reading the local community level, we also employ passive sampler devices and lower cost sensors. We do all this monitoring to help gauge the health and safety of air quality for humans, animals, and the environment, with a real focus on criteria pollutants or those that directly affect human health. The safe levels of air pollution are determined by the Alberta government through the Alberta Ambient Air Quality Objectives and Guidelines, which are built upon national standards from the Canadian Council of Ministers of the Environment and even international ones through the World Health Organization. As airsheds, we need to ensure we're monitoring for the right parameters in the right places so that we can provide an accurate and representational picture of air quality. Variables like emission sources, population densities, and now, more so than ever before, weather patterns all shift over time. Taking all of these into consideration, we need to be predictive and keep abreast of emerging trends. We're using statistical techniques to help forecast and predicate more than ever before as a direct result of climate change impacts. As we teach in our school programs, air quality is the sum of air pollutants plus weather. Simple little formula we do at elementary school. So in a simple example, a community can emit high levels of pollutants, but still have excellent air quality as winds disperse the pollutants elsewhere. Or conversely, pollutants can blow in from outside the region. And it's not just wind speeds and wind directions, of course, temperature, humidity, even sunlight impact chemistry in the air and the resulting air quality. We can already see the impact of climate change on weather patterns just in the past week. Hurricane Fiona, of course, devastated our Atlantic provinces and broke some records with wind speeds up to 177 kilometers an hour. While the impacts look different in different places, we don't have to look too far away to see the emerging stretches of very hot, dry weather in the summer. You know, these heat domes raise the level of ground level ozone, nitrogen dioxide, not to mention drying out the forests, causing more frequent wildfires, which in turn throw dangerous levels of particulate, black carbon, and VOCs into the air. So as airsheds, we really need to be more conscious about the changing weather as a result of climate change. Thanks again to Phil and Marika for their work and for joining us today. With that, I'll turn it back to you, Julie, and I'm available for questions.
Perfect. Thank you, Gary, for setting the stage that way. That's really valuable context in terms of the work that airsheds do and how that works with, on the federal scene and with Health Canada. So with that, I'd like to give a more formal introduction here to our speakers. So Marika, maybe give a little wave for everybody so they can see you. Marika leads the air sector's health assessment section in Health Canada's air quality program. She has 30 years of experience conducting human health risk assessments for air pollutants. Her team evaluates the health risks associated with air pollutant mixtures from multiple sources of air pollution, including diesel exhaust and traffic-related air pollution. Her team's work includes assessment of the health burden of air pollution, as well as of individual sources of air pollution, and the health benefits associated with emission reductions and mitigation strategies. So welcome, Marika. And I will introduce Phil as well, because I understand it's going to be a bit of a tag team presentation here. Yeah, thanks for that wave there, Phil. And so Phil has more than 30 years experience in air quality science and is presently the Senior Science Advisor for Health Canada's Air Quality Program. His responsibilities include contributing to the development of research priorities and supporting the operation of the program's research governance process. Phil has a Bachelor of Science in Chemistry from Carleton and a Master of Science in Toxicology from Memorial. Welcome to both of you. I'll let you start sharing your screen, and then I'm going to sit back and learn a whole lot.
Let me try the technology here. Let me know if that's working.
That's working, yeah. We'll just get it to the presenter mode. Wonderful.
Okay, perfect. Well, thank you very much for the invitation, Julie and Gary, and to everyone who's attending for your interest in this topic today. So climate change and air quality are intimately linked in a number of ways, including in terms of the pollutants involved, the atmospheric processes that affect both, and the sources, of course. So really the goal of our presentation is to give an overview of how those linkages between climate change and air quality can have important implications for population health in Canada. So first we'll give a little bit of a context around the recent national assessment process for climate change that's been underway, and particularly the health assessment report that we contributed to within that. And then we'll go into really what was written up within the chapter on air quality in terms of how climate change affects air quality, what the potential co-benefits of climate mitigation can be, the issue of wildfire smoke, adaptation and risk mitigation around outdoor air quality, and then touch on indoor air quality and aero allergens, as well as a brief look at vulnerable populations, and then conclusions. So I'll speak for the first half, and then I'll pass it over to Phil for the second half. The health assessment document was a one science assessment within a series of reports produced by led by the federal government, but authored by many, many individuals across different organizations in Canada. So you see here at the bottom, I should put my cursor here, Health of Canadians in a Changing Climate. That's the report we'll speak to today. The first report that came out was Canada's Changing Climate Report, which was issued by Environment and Climate Change Canada in 2019, which is an authoritative assessment of the science of climate change in Canada. NRCan has produced, that's Natural Resources Canada, has produced a national issues report as well as a report on regional perspectives. And then it's anticipated that there will be a synthesis report as well as one targeting Indigenous resilience. So all the reports are available at changingclimate.ca. It's a very nice interactive website, and there's many targeted outreach products as well. So getting into the chapters of the health assessment. So the health assessment was titled Health of Canadians in a Changing Climate, Advancing Our Knowledge for Action. We also refer to it as the Climate Change Health Assessment, so the CCHA, which you may hear Phil and I say during this talk. So air quality was chapter 5 amongst those, the many chapters. And I'd just like to mention that the previous comprehensive assessment of health and climate change for Canada was published in 2008. And there were a number of new issues that were addressed in chapters this time around, really reflecting the evolution in our understanding of how climate change is affecting health. So there was a chapter on climate change and Indigenous people's health, a chapter on mental health and well-being, a chapter on health equity, which I think represent important developments. So Phil and I were lead authors. There were many, 15 lead authors across the whole report, but 76 contributing authors and many expert reviewers. There's a number of resources that we hope are useful to yourselves and perhaps your networks. The individual chapters are available. For each chapter, there's a summary document. There are key messages. There's fact sheets for the document as a whole, as well as decision maker briefing notes that target medical professionals, public health, and so on. And there is a technical summary presentation available. And as well, there's a Trello board, and we'll share the link later via Julie, that includes graphic cards, infographics, and tweets that hopefully are helpful and can be used by organizations broadly. So now getting into the topic of the day, the air quality chapter. So Phil and I were the lead authors, but we had many contributing authors, climate scientists and air quality scientists from Environment and Climate Change Canada, a number of scientific colleagues throughout Health Canada, as well as Dr. Mike Flanagan from the University of Alberta. So just to set some context, air pollution and climate change really are two of the major environmental threats to health that we face. I'm sure most of you are very familiar with air pollution. It is a leading environmental cause of death currently, both globally and in Canada. Globally, it's estimated that ambient air pollution causes 4.5 million deaths per year. In Canada, we estimate 15,300 premature deaths per year as a result of air pollution, for a value of about $120 billion annually. There's a very wide breadth of adverse health effects from PM, ozone, and NO2, including premature death, respiratory and cardiovascular outcomes, cancer, and information currently developing regarding other endpoints such as neurological, reproductive outcomes, and so on. So we're all exposed all the time, and there's no threshold of effect in the population. So the implication of climate change, which we'll discuss, it's something important to consider from a population health point of view. The map you see here is a map of the premature deaths per 100,000 population by census division across the country currently. And climate change, of course, is the challenge of our time. The WHO calls climate change the single biggest health threat facing humanity, as it affects many of the social and environmental determinants of health, including clean air, safe drinking water, sufficient food, and secure shelter. So before we get into the health side, we've just brought forward a few of the key points raised by the Canada's Changing Climate Report, which assessed the science for Canada on climate change that are relevant for us to consider in the air pollution context. So firstly, both past and future warming in Canada is on average about double the magnitude of global warming. So we are not separate from this global phenomenon. In fact, we are double the magnitude. Widespread warming is already evident across many parts of the country, and it's projected to intensify in the future, including through intensification of weather extremes. However, the rate and magnitude of climate change, and of course the implications under high versus low emission scenarios, project different futures for Canada. So there is still potential there for us to ameliorate the situation. Okay, so how do climate change and air quality, how are they linked? Well, firstly, all things being equal, climate change will worsen air quality because of higher temperatures, higher biogenic emissions, so those are emissions from forests, for example, increases in wildfires, as well as increases in the distribution of Aero Allergens, so those are pollens. And we'll talk about these issues more. Secondly, some pollutants are also climate pollutants. These are termed as short-lived climate pollutants, or SLCPs. Some of them have a warming effect, such as black carbon and methane and ozone, and some have a cooling effect, such as sulfates and nitrates. They're short-lived climate pollutants because they have a relatively short lifetime in the atmosphere compared to CO2, but they are an important category of contributors to overall global warming. And then thirdly, climate pollutants and air pollutants share common sources. If we think about transportation or the production of electricity, et cetera, we have very similar sectors contributing to emissions of both. To examine these interactions and to project air quality and climate change into the future really requires an integrated framework, modeling framework, This generally involves downscaling global climate models to reflect regional climate information. Oh, I'm sorry, I think I have to do something. And regional climate models can then feed into regional air quality modeling. And when we say regional, we're really talking about at a continental scale. And the output from regional air quality modeling can be used to look at the health impacts of a change in air quality and the value of those health impacts for society. And we'd just like to mention that the IPCC, which is the world's leading body for the assessment of climate change, has developed a number of series over time with their assessment reports of plausible scenarios of population growth, GHG emissions or concentrations, energy consumption, and so on, that are standardized to a small number of scenarios. And those types of scenarios are often assessed to look at the health impacts of different climate projections. And this allows for comparability between studies and provides a wealth of data in terms of both GHG emissions and air quality emissions under these standardized scenarios. So firstly, given the same air pollution emissions, a warming climate is expected to increase ozone, and there's more and more evidence that it also will be associated with an increase in PM2.5. Now, the increase is not homogeneous across the world or across a country. There will be regional differences, for sure. So for the assessment report, we did an analysis collaborating with ECCC scientists who had published a modeling exercise looking at the effect of a warming climate in 2050 on summer PM2.5 and ozone. That was by Kelly et al. And we looked at the health implications of the warming that they modeled from an air quality point of view. And we estimate that the impact of climate itself, which is called the climate penalty, would result in about 850 excess premature deaths per year from air pollution, as well as hundreds of thousands of morbidities if you think of asthma symptoms and so on, hospital admissions, for an annual cost of about 2.7 billion at mid-century. Most of the impacts were estimated for Ontario and Quebec because of both population and where emissions occur largely. The US did a similar analysis looking at the climate penalty there for ozone for 2030, and they estimated as well several ppb an increase in ozone, and again hundreds to a couple of thousands of premature deaths per year by 2030 as a result of the RCP 8.5 scenario. So this is an IPCC scenario that reflects less stringent, the least stringent scenario in terms of GHG controls. And they found that there was an order of magnitude fewer impacts, health impacts, under RCP 6.0, which is a more stringent, but still a medium stringency scenario. And then finally, globally, there was an analysis published a couple of years ago looking at PM2.5 in particular, because the evidence around PM2.5 there's been less of it. More people have studied ozone under climate change, and the effects have been, in some cases, increases, in some cases, decreasing. This analysis looked at 7 different global climate models, because of course there's variability between models, and found that overall, the majority of models found the PM2.5 health risks would increase because of a warming climate in 9 of 10 world regions, including North America. So we can expect a climate penalty. So climate change can worsen air quality, but the flip side of that is that climate mitigation policies can result in lower air pollution emissions because of changes in activity levels of common sources. We think about transportation, which is currently undergoing a shift towards electrification. So the integration of air quality health co-benefits into the climate change framework from a policy perspective has a number of benefits. Firstly, it provides immediate and local societal benefits from the air pollution reductions, and those benefits accrue annually into the future. So if we make the changes now, they happen immediately and the local population sees the benefit. These benefits can really help to offset the potentially large societal costs of climate mitigation. It also does provide an opportunity for us to look more strategically at climate change mitigation options and to optimize options for also obtaining co-benefits, as well as to avoiding unintended negative consequences. So these health co-benefits are sometimes presented in the literature as avoided deaths, but sometimes also as marginal co-benefits. So that's the dollar value of those health benefits per ton of CO2 reduced, which can be compared directly to the marginal abatement costs, which are the dollars of bringing in the mitigation option per ton of CO2 reduced. So we have a few examples here. For Canada, we did an analysis within the CCHA that estimated that the RCP 6.0 scenario, so that is a moderate mitigation projection, would result in about 5,000 avoided deaths in Canada in 2050, which was consistent with other analyses done under a more stringent scenario, 4.5, by Jason West a few years earlier. The US, there was a US study that published the marginal ozone and PM 2.5 benefits at $45 to $137 per ton of CO2 reduced. And globally, there was an analysis that looked at the overall co-benefits at a global level of meeting the Paris Agreement temperature targets and estimated them to be about 1.5 to 2.5 times the cost of mitigation. So the numbers here, I think, are not specifically important. It's about, there are different scenarios and different projections and different analyses out there. Certainly the direction of the benefits is very important, but really what I want to bring to the fore here is that the value and the types of information that we can bring to the policy discussions through these types of analyses. We included a case study from Canada of an analysis of co-benefits that was associated with regulations that targeted reductions in CO2 emissions from coal-fired power. These were published in 2012. And really the goal of the regulations was to shift to lower non-emitting types of power generation from a CO2 point of view. Every regulation requires a quantification of all of the costs and benefits of federal regulations. And these are related in the regulatory impact analysis statement. So we did analysis of the health co-benefits from air pollution reductions. And over the 20-year period up to 2035, we estimated that the regulations would result in avoidance of 900 premature deaths from air pollution, 800 hospital visits, 120,000 asthma episodes, and that the whole value of the benefits to health was about $4.2 billion. And this can be compared to the overall net benefits of $7.2 billion of the regulation. So it was an important part of the story to consider. Those regulations were further amended in 2018 to accelerate the phase out of coal, and we estimated additional avoided deaths associated with those regulations for a total value of $1.2 billion. So this really just underlines the importance of the integration of air quality and climate change in policy decision-making, and how those benefits can be realized. Some benefits can be realized immediately. Switching to wildfires, another major issue and perhaps the greatest threat to air quality from climate change, and the greatest threat to air quality, I think, facing us over the upcoming decades. Canada has about 9% of the world's forests, about 8,000 wildfires annually. And of course, wildfire smoke is full of the regular pollutants with which we have great health concerns. Wildfires are also one of the largest contributors to PM2.5 exposure in Canada. And we expect an increase in the severity and the frequency of wildfires under climate change. We could not project wildfires under climate change scenarios for Canada. We don't have that modeling capacity in Canada at this point in time. But we also didn't have a baseline at the time of doing the air quality chapter of the health assessment report. So we decided to see what the health impacts are now. And we estimated, in collaboration with our colleagues at ECCC who did the air quality modeling, we estimated the contribution of wildfire smoke from 2013 to 2018 to ambient PM2.5 levels across the country. And you see two maps here. These reflect, so I should say the axis, the color axis there, color coding is not linear in scale. The darkest color reflects 15 micrograms per meter cubed, but these contributions are for the wildfire season, so they represent a 5-month average from May to September. The contribution from wildfires in North America to ambient concentrations. We estimated the health impacts from the smoke annually and estimated overall, combining acute and chronic exposure premature deaths, approximately about 600 to 2,700 premature deaths per year in Canada from wildfire smoke, including, of course, many non-fatal health impacts, which I just, for simplicity, will not discuss here, but we can think of hospital admissions and asthma attacks and so on. And the socioeconomic value was about $5 billion to $21 billion per year currently in Canada. The greatest impacts were in B.C. and Alberta because of proximity to the wildfire activity, but the long-range transport of the smoke resulted in substantial impacts even quite far away. Toronto was in the top 10 CDs in terms of impacts just because of the very large population impacted even by a small concentration can have a big effect. So the worry, of course, is this is a source that is difficult to control and it's expected to increase over the century. A study from the US was able to model future emissions and estimated, I guess we'll just jump to that last bullet, that the climate effect on the health impacts of wildfire smoke were projected to increase about 60% due to the RCP 8.5 scenario relative to baseline conditions. So under a relatively unmitigated projection of GHGs, we'd expect climate to be providing a 60% increase. Okay, I will pass it over to Phil now. And Phil, just let me know when you want the slides changed.
Sure. Okay, thanks very much, Marika. So I'm going to shift gears a little bit and talk about adaptation because there's, as much as we try to mitigate climate change, it's already happening. And there are many things like wildfires, which are not under direct control. So in the context of air pollution, as the climate puts more pressure on us to, in terms of our exposure to air pollution, we are going to need to pay more attention to certain things that we can do to protect the population's health through these things, through different actions. So there's short-term tools that are listed here. The top one's largely coming with information that we can get from air quality monitoring and modeling. And so we have forecasts, we have reporting, we have warnings, we have interventions. And then there are long-term adaptations in terms of organizing our communities better to make them more resilient. Urban green space is one example of that. So next slide, Marika. So the Air Quality Health Index, I think, is probably familiar to a lot of people on the call. It is a tool that we developed in the early 2000s primarily to explain, to communicate the health risk of air pollution to people. So it's health focused, both in its derivation and in its communication. The three pollutants that are used in the AQHI are the PM 2.5, ozone, and nitrogen dioxide. There's collaboration. Environment Canada does the forecasting and the modeling. The provinces are very much involved in the monitoring aspect and in the public communication. And we've developed health messaging that has different levels so that we can distinguish between people who have more or less risk. And so the AQHI is now being used in all the provinces in Canada with the exception of Quebec. It's a 10-point scale. We've categorized the different levels in terms of level of risk, low, moderate, and high. Those are relative aspects. And then above 10, we put it at very high because the messaging remains the same at that point. Next slide. So as I say, there's the scale and there are the two sets of populations that we target with different health messages. One of the things obviously is that we don't want air quality messaging to deter people from getting from healthy activities when there's limited risk. And so for the at-risk population, they may need to take measures sooner than the general population. So in the low-risk range, we're talking to both groups to enjoy their activities, but there's in the moderate range, people who are have higher risks should consider reducing their actions, or reducing their strenuous activities, basically trying to do things to limit their exposures sooner than those who don't have a reason to particularly be concerned. Next slide, please. Okay, sorry, go back a bit. Did I talk, do I have who's at risk here? So I'm not sure. Let me just explain that the at-risk population are people who have chronic conditions like asthma, chronic obstructive pulmonary disease. Also, air pollution is very important in terms of cardiovascular outcomes, so those people should consider themselves to be at higher risk. And then people who are working outside, strenuous activity, children and the elderly also have higher risks. I think we're probably going to come to that to another slide, but I think I want to stick it in here anyway. So go ahead now. Thank you. So in terms of wildfire smoke, it's becoming more and more important to be able to give people information that they can deal with during wildfire smoke episodes. While the smoke can travel long distances, certainly Alberta's had substantial experience with smoke traveling from the western areas and basically settling over cities, but also a lot of problems. And so the identification of this and the prediction of this is very important. So Environment and Climate Change Canada has a wildfire smoke prediction thing called Firework. There is also another system called Blue Sky, which is a sort of an ensemble modeling system, but that one you may be familiar with. It's used in Alberta in a collaboration with Environment Canada. They're both very good tools for keeping people informed of what's happening, what to expect in terms of air quality. That said, of course, you know that smoke can move in and out of an area very quickly. So it's an incredible challenge to try and have an accurate, up-to-date prediction system that's relevant to people, because you can get very extreme levels in short periods of time. So the adaptation measures that people can take in terms of wildfire smoke, there are structural ones, societal ones, such as developing clean air shelters, institutional and residential systems for filtration, so people can have upgraded systems in their homes, or they can simply take measures in their homes to reduce the infiltration of air into the home and keep the air clean. So with an air conditioner, you turn off, you're not bringing air in, you're recirculating the internal air. Evacuations, community evacuations generally only occur because of the wildfire risk itself, rather than the air pollution exposure. Masks are, you can look on the different websites. I was looking just before this meeting, there's different messaging from different sources on masks as we gather more information. N95 masks, which we're much more familiar with now than we were 3 years ago, can reduce exposure to smoke. However, they need to be correctly fitted to be useful, and all of the things that you would have heard in the context of the COVID pandemic about not using masks. But masks are useful in certain circumstances. In comparison, or by analogy, it's much similar to the sort of measures you take to protect people in an occupational environment. Personal protection, like masks, are sort of your last level. You try to do the broader things more quickly or more initially, and masks can be sort of your last resort. We have published guidance for cleaner air spaces during wildfire smoke events, which are useful for both community level systems and also for adjusting, doing things to reduce exposure in residential circumstances. But in some cases, people should be moved into or encouraged to go to a designated cleaner air space where there's good air filtration and good temperature control as well, because heat and air pollution often come together in a wildfire circumstance, and there's obvious need for caution on both. We'll have other outreach projects. Within Health Canada, we also have a program to deploy emergency air health monitoring equipment during episodes. So that is another system that we have in place to provide support to communities that are dealing with wildfires who may not normally have access to or an ongoing air quality monitoring system. So we have a setup to get those deployed out very quickly and provide information. And in addition, in an effort in recognition of the wildfire smokes, and if you think smoke problems that are evolving, if you think back to the map that Marika put up earlier, you'll see that wildfires occur largely in the northern and western parts of Canada, where there is less air quality monitoring. So Environment and Climate Change Canada, the Meteorological Service of Canada, have a program going now with low-cost sensors to supplement the information for on wildfires. And they're also feeding that information back into their smoke prediction system. Next slide, please. So in terms of messaging for wildfires, this is an example British Columbia developed in terms of the messaging. You can see there's still, the air quality health index. Risk categories are still there. British Columbia has developed a system for smoke events that are based solely on PM, that makes it more possible to respond quickly to wildfire circumstances and to make use of it in areas where the full suite of pollutants aren't available. But you can see the advice that's here in terms of using portable air cleaners, tightening up the house, trying to keep stop infiltration. But you need, the importance of not overheating. And then the idea of going to some sort of shelters that are either designated or where the air is going to be cleaner, or where if you lack air conditioning. And I already mentioned the N95, or the idea of moving to another location. Next slide. So another shift, indoor air. people don't think about climate change being an indoor air issue very much, but there are connections, and I'm going to talk about those for a little bit. We spend most of our time indoors, and poor indoor air quality also affects people's health. Next slide. So indoor air is obviously influenced by the air that's coming from outside. Different pollutants come in different ways and in different in manners. Ozone, which is very reactive gas, you don't find much ozone penetrating indoors, but there are reactions that happen as the ozone comes in contact with surfaces that can release other pollutants such as aldehydes, which have their own health effects. Smoke and smog can come in, can get into your house, and just in the ways we've been talking about. So those tensions are issues. The other thing that in terms of climate change, in rising temperatures during heat waves, is that many of the products we have in our homes will release volatile organic compounds, and that, over time, this off-gassing from building materials, from composite wood, et cetera, can increase as a result of higher temperatures. Ambient temperatures can also affect the ventilation in your house, the chimney effect that you get in your house. And so there can be a shift in sort of the normal functioning of the building envelope as, when you're in higher temperature regimes. That may not be ideal, that the housing design may not have incorporated into it initially. The other aspect in terms of impacts from climate are basically what we've seen in the news in the last few days with the storms in Atlantic Canada. A flood of whatever the cause is an invitation to mold. And mold is a very important indoor contaminant that has considerable effects on people's respiratory health, both short-term and long-term. So flooding is always a problem, whether it comes from storm surge in the Atlantic provinces or sudden storms bringing about flooding over, rivers overflowing and those sorts of things. And equally during these events, they're compounded by loss of electricity, at which point your sump pump stops working, so you have flood. These are sort of basic. And one of the things we always worry about with extreme weather is carbon monoxide. When people start running generators, unventilated indoors, or space heaters using kerosene or something like that, or even fireplaces, you are taking the risk that if this is not sufficient ventilation of these combustion appliances, that you can get death in a very short period of time, or simply long-term effects. Candles are wonderful for birthday cakes, but they do contribute to airborne particulate, and they're best avoided. And people with emergency plans should have some sort of other lighting system than simply relying on candles. Next slide. So one of the things in terms of the long-term planning is making sure that houses are designed for the climate and the circumstances. So trying to tighten up houses is an advantage in terms of reducing infiltration of air pollution, and also in terms of protecting from hot air or cold air in the wintertime coming in. But there needs to be ventilation in the houses. There needs to be some means to remove the pollutants that are originating from the indoor sources, either from combustion products. Humidity is essentially a contaminant that creates mold. You need to ventilate your houses for that. and also the chemical contaminants that may be coming off of, as I said, furniture or building materials. In terms of things that can be done at the building scale, the living scale, there are ways to reduce emissions from VOCs, to buy low VOC emitting products or better systems, air conditioners, any sort of well-designed ventilation systems, furnace filters that remove particulate matter, higher efficiency, going up to the higher MERV values, and then of course portable air cleaners. And a lot of this stuff has become a lot more familiar to us in the last couple of years as we try and reduce infectious risks in the homes, which is another component, as you need ventilation for those issues as well. I've mentioned the clean air shelters. They're a model for community action, and then making sure people know what to do is the primary outreach adaptation action. Next slide, please. So another aspect, and this is interesting, is aero allergens. We talk about the pollen and fungal, and Marika touched on these. Just as sort of a bit of a background, a lot of people are very vulnerable to pollen, mold. More than 7 million in Canada get rhinitis, which is essentially a runny nose due to allergies. 3 million with asthma, of which two-thirds, so 2 million people among that 3 million are allergic to aero allergens. The health outcomes associated with aero allergen exposure are increased emergency room visits, hospitalizations for asthma, increased risk of heart attacks, myocardial infarction in the elderly, and there's also an association with early delivery of term pregnancies. So not what you would qualify as a premature baby, but there is an association between increased exposure to pollen levels and these, the baby being born slightly earlier, which has been associated with long-term health outcomes. Next slide, please. So a little more on the aero allergens, the sort of things that are happening with climate change, which climate change is driven by carbon dioxide, and so that and the carbon dioxide itself is having a direct impact. So we're seeing increases in the pollen season. We're seeing increases in geographic distribution. We're seeing more pollen in certain circumstances as temperatures go up, and the projections are that this will continue as the climate as climate change continues, as the climate warms. The carbon dioxide actually directly affects the allergenicity of the pollen, and the result is more people exposed. More people exposed means more people are sensitized, so they're developing more allergies depending on their genetic circumstances, and we have these increases in these diseases. The adaptation actions that are possible are forecasting, better medical treatment, making sure that people are properly cared for in terms of their allergy. And as we shift into a greener environment, certainly in urban areas, planting trees and plants that have low allergenicity rather than something that's going to cause people a lot of distress and a lot of discomfort. The next slide, please. So this is where the at-risk population slide turned out to be. I was looking for it. And the risk, as I said already, children of developing lungs, they breathe more than adults per unit size, relative to their body mass. So they have more exposure to air pollution. The elderly are at greater risk because of the accumulation of illnesses that come with you as you get older, and therefore they are sort of a population with greater risk to air pollution. People with cardiovascular disease, asthma, COPD. I already mentioned the effects of allergen on birth delivery. There's also accumulating evidence, as Marika indicated, of associations between different birth outcomes and prenatal exposure to air pollution. And these birth outcomes, like low birth weight, preterm birth, reduced head circumference, all have been also associated with longer term health outcomes. Diabetes seems to have a strong association with air pollution exposure. Again, it's an emerging area of research. It's not as intuitively obvious as, say, asthma or something like this, but we do have the epidemiological evidence to support this. And of course, your actual activities that cause you exposure. So if you live in a place that's more polluted, then you're going to have more exposure. And if you spend more time, if you're an outdoor worker, then you're going to have more exposure. So you can get into interesting analyses here in terms of air pollution risk in terms of urban and rural populations, because there are some of these characteristics that are more common in rural areas, but then in urban areas you have more likely to have greater exposure. So the estimate there is about 1 in 3 Canadians have a risk factor, at least one of these risk factors to increase their vulnerability. So we have a large, we have all of these issues coming together, and combined, we've been dealing with air pollution for quite some time, but the effect of industrial emissions, wildfires, the increasing the heat domes, the heat episodes, the environmental conditions that trap air pollution close to the ground. All of these things are things that we have to prepare for being greater concerns with the changing climate, notwithstanding the mitigation measures and the co-benefits there. So next slide, please. Certainly one of the things that, the assessment, the overall assessment found, and we see as well in our air pollution chapter, is that the people who are the worst off to begin with are going to be most seriously affected by the changing climate. So if you're low income, or even if you just live in a low income underserviced area, racialized populations and immigrants have greater risks because of their work and living circumstances. There's inequities in terms of access to health care, which affects how severely you're affected both by air pollution and by the other components of climate change, the severe extremes. Talked a bit about housing. So obviously, if you don't have ideal housing, you're going to have greater exposure. And certainly another aspect that's been quite clearly noted is that indigenous populations have greater susceptibilities. In terms of air pollution, many indigenous populations already have disproportionately high respiratory and cardiovascular disease. So they are vulnerable from that situation to begin with. There are various causes for that. Again, there's social inequities, living environments, overcrowded housing is a contributor, is a problem when you have inadequate ventilation and you're trying to get by or keep the building adequately ventilated, but you don't have the equipment to do so or the tools. And then, of course, Canada's Indigenous populations live often in areas that are in proximity to the forest, and therefore they're closer to wildfire smoke. Next slide, please. So to wrap up, and I suspect we've gone over, but I apologize. Our issues on air pollution are that it is the most important environmental cause of death, globally and in Canada. You look at different issues in terms of health outcomes. Air pollution is one that ranks quite highly among the environmental aspects, aside from behavioral issues. There's no disentangling these issues. Climate change and air quality come together in terms of sources and processes and who's being affected. We know that as the climate warms, it's going to increase the presence of some pollutants, but the upside is that when we take actions to reduce climate pollutants, we can reduce air pollution. It's important to pay attention to how much and which actions have the best effect in order to get the greatest societal benefit. Wildfires are a major concern, and in terms of air pollution, they're becoming a major, a really increasingly important aspect of what the pollutants that people are being exposed to. Indoor air quality is part of the picture, as are Aero Allergens. And we need to develop these adaptation and mitigation strategies, such as good forecasting systems and getting people to understand the health risks. So I think that's all. Thank you very much. And I guess we're good for questions now, Julie.
Perfect. I want to thank you both for that presentation. Everything from the indoor air quality to the outdoor air quality to, what's happening with wildfires and how that's really changed that map that you had on around, where that orange spot was much more, in the States, and how it's really expanded into B.C. and coming into Alberta, and how that is changing, and how we can expect wildfire smoke to be an impact even more so in the future. And, around the cost analysis and really how those, investing in the mitigation strategies has a huge health benefit and a financial benefit when we take those actions. So the implications for policy. Because we are over time a bit, I think what we'll do is, for anybody who has questions, by all means, send them my way and we'll facilitate that afterwards. But I do really want to thank you for the presentation. There were so many good nuggets in there. I've got all these notes and things on my notebook. A quick note to anybody online, we will be sending out links to that Canadians in a Changing Climate report. The Health of Canadians in a Changing Climate report from Health Canada, as well as a link to the Health Canada listserv where you can get emails around updates on this topic and others, as well as that Trello board that Marika mentioned. One last reminder, the next Clean Air webinar is coming up on October 27th. That's a Thursday at noon. And we will be speaking with folks from the Canadian the Clean Air Strategic Alliance, CASA, regarding their recent report that just came out around the reductions in transportation that we saw during the, COVID in 2020, 2021, and the impacts that had on air pollution. So that is going to be quite an interesting discussion as well. So before we close out, I'd also like to acknowledge those working behind the scenes to put on today's webinar. We have Russ Miyagawa on technical support, Serena Tang, who, has been capturing some good snippets for social media, and we'll be sharing those on our different channels. And, once again, Marika and Phil and Gary, of course, thank you for your time and for everything that you put into your presentations. We're quite pleased to feature your work and to help bring awareness to these issues and opportunities that are out there. I'll pass the floor on one more time. Any last words from either of you?
Thank you again for the invitation, and apologies that we went over. I apologize to the audience. If you have any questions, please send them in. We're happy to have a discussion or emails back and forth to address any questions. But thanks again, Julie.
Yes, thank you very much.
Wonderful. Thank you both. And Gary, I don't know whether you're in a situation you can unmute, but thank you for dialing in from your poor connectivity area. Everybody, have a great day and thank you so much.